Hello, everyone. This recording is to review Chapter 13 of the Schneider textbook, required textbook, Do People Choose Their Own Health? This is part of our health disparities section. Did you know that the leading cause of death um, are listed as tobacco use, poor diet and physical inactivity, alcohol consumption? This can probably also be expanded to substance use and substance consumption to include other substances such as opioid um, use and other type of uh, drug use, microbial agents, toxic agents, motor vehicle accidents, firearms, sexual behavior, and illicit drugs. Again, I'll repeat this. The leading cause of death in the United States come from tobacco use, poor diet and physical activity or inactivity, alcohol consumption, drug use, microbial agents, toxic agents, motor vehicles, firearms, sexual behavior, and illicit drugs. These account for almost half of all the deaths in the United States. The scary part about those causes are that most of them are preventable. Most of those deaths occur causing what we would consider premature loss of life, and most are caused by individual behavior. And these are the targets of many of the public health interventions because of the death toll that it takes on many Americans every year. Tobacco is the leading actual cause of death in the United States. Tobacco causes cancer, cardiovascular disease, chronic obstructive lung disease, um, low birth weight in infants, marginally, and burns due to accidental fires. I do not know tobacco use to cause infant death. Um, that has not been my experience working in a newborn intensive care unit for many years, but definitely slightly lower birth weight for infants. You've noticed that there are a lot of um, smoking cessation programs. As public health made tobacco a priority, you also saw a lot of regulations over the last, I would say, 10 years related to tobacco use. You've seen building signage and laws restricting use of tobacco and smoking in airplanes and in apartment buildings, in public places. You've seen a lot of bans on cigarettes in terms of how they're able to market their products and having clear warning signs listed on the labels related to the carcinogenic effects of tobacco use. And so you've seen a lot over the last 10 years of public health efforts. Lately, you may be seeing a lot of ads on TV with people giving personal narratives of their use and how they've contracted certain types of oral cancers and surgeries. Oftentimes, these commercials are pretty graphic in presentation as a deterrent effect to tobacco use. And so you've seen a lot of efforts to try to improve the use of tobacco or decrease the use of tobacco, improving outcomes for people. Other public health regulations that you've seen related to tobacco includes increase in the cost of tobacco, almost making it unaffordable for many people, as well as associated taxes on tobacco products. All these are regulations and efforts and to help improve public health. Poor diet and physical inactivity is the second most actual cause of death. Poor diet and physical inactivity can lead to chronic health conditions such as obesity, heart disease and stroke, diabetes, and cancer. Ironically, when you think about health disparities related to chronic conditions, you will see that people of color and poor people have higher incidence of obesity and deaths related to obesity, higher rates of heart disease and stroke and death related to that, diabetes and diagnosis and deaths related to that, amputations as well, cancer diagnosis and deaths related to that as well. Again, poor diet and physical inactivity. There are plenty of reasons, theories why this occurs. We do know that it's not because of the color of your skin. We do know it is based on the social determinants that impacts those health disparities or those changes in outcomes related to chronic health conditions. For example, we know that there are very few um, gyms and that are accessible and or in walking distance of a lot of poor and impoverished neighborhoods. We know that when people are poor and they are needing to survive, um, um, food, water, electricity, and housing costs, they oftentimes don't have the extra money to go to the gym and to focus on those physical activities. People work schedules oftentimes they're working two or three jobs don't allow for that. We also know in a lot of poor neighborhoods there are food deserts. So even when there are available food, it's not healthy, nutritious. That leads to poor diet. Oftentimes, a lot of people who have low financial means shop at certain types of stores. Think about your Save a Lots. Sometimes your Aldi's, even though Aldi's is a lot better of having a lot of nutritious foods, fruits and vegetables there as well. But oftentimes a lot of mom and pop stores do not have those type of nutritious foods. They tend to have chips, sodas, the corner store type foods, and that also leads to poor diet. The other thing is there have also been some public health initiatives to try to improve diet, particularly obesity for kids. They're removing a lot of the vending machines out of schools, or they're replacing them with healthy snacks. You'll see a lot of schools are pushing parents to only be able to send healthy snacks rather than sugary products, high salt products. So you start seeing a lot of push for the schools to try to help with this public health issue of obesity with children. And so you have seen some work. I actually saw a news report today saying that in some states there are laws that's going to remove uh, the unhealthy snacks that are located right next to the cash register, and moving the sodas, the gum, the candy bars, and having them replace it with healthy snack alternatives such as nuts, fruit, and milk, for example. They are allowed to keep that next to the register, but not the sugary snacks, and that's in snacks, and that is in some states. Some states have exorbitant taxes for sugary products, particularly soda tax. That's a big deterrent as well. And so there are things that are being done, but not enough, especially for vulnerable, poor and vulnerable populations and people of color. And so that is a important area. So think about that as one of the areas of focus for public health to improve outcomes. Misuse of alcohol, and I'm going to add other substances, lead to motor vehicle fatalities, chronic liver disease and cirrhosis, home injuries. Think about somebody accidentally um, passing out because they're drunk and setting the house on fire, or falling down the steps because they're inebriated and they break a arm, a leg, or worse, a neck. Drownings occur often because of use of substances. Fire fatalities often occur through misuse of substances. I'll also add here injuries related to domestic violence, as a lot of people do drink and they become what we call belligerent. Job injuries occur because people are coming to work under the influence, intoxicated. Also, cancer and underage drinking is attributed to misuse of substances and alcohol. Microbial agents are the fourth leading actual cause of death. They're encompassed the top three killers in the 1900s, and they have by no means been conquered at this time. Um, this slide also points out that we have not conquered microbial agents, which you can consider those as microorganisms. And oftentimes those microorganisms cause bacteria and diseases and viruses. It could move to a higher position on the list in the future, is listed in this course textbook. And ironically, we are dealing currently with a virus. We're dealing with COVID-19. And so it'll be interesting to see if microbial agents um, related to this public health um, issue that we're having now with COVID-19 may increase the leading cause of death for microbial agents in the near future. Toxic agents are the fifth leading cause of death. The fact that toxic agents are only listed fifth is evidence of success in environmental health. We talked earlier in the semester about how toxic agents can pollute water streams, can pollute the air. Oftentimes, when we think about toxic agents, we also think about industry and big business and how factories emit pollution in the air. We also think about cars and automobiles, and that's why we oftentimes, or a lot of states, do emissions tests to see how much toxic agents are in the air, and radiation is another concern in terms of toxic agents. But again, fifth leading cause of death. Public health intervention. So what do we do? What do we do to address these public health concerns and how to improve overall health outcomes in the United States? One of our strongest components is education, health outreach. Oftentimes, um, it's done on the grassroots level or in health settings such as primary care clinics. To give you an example of that, there are some organizations that do what they call neighborhood canvassing, where they knock on door to door and provide information about common health hazards in the neighborhood. At one point, lead poisoning was a big issue in public health, and so there were certain states and cities who have houses built before a certain time period that use lead paint, and they were seeing high incidence of children um, in pediatric office testing positive for lead. Lead is very poisonous and can be very detrimental over time for small children. And so we had target areas in which we would do lead education canvassing, where we knock on doors educating families with young children on lead paint and how to reduce that toxin in the area. Other ways that you can do health educations are public service announcements. It's an activity that you'll be doing in this class. You may see public service announcements that may educate uh, um, um, consumers and people who live in the U.S. about risks as well. So when you think about education, think about education about risks related to health conditions, education related to interventions, okay? But we also think about early screenings if possible, especially when we want to focus those health education initiatives on groups that we know have higher incidence of disease and illness. So education is one of our biggest champions for public health interventions, really letting groups of people know that they're at higher risk for certain outcomes, particularly with related to health disparities. Education and educating key groups that they are higher risk for morbid or mortality outcomes. Another example of that would be education in terms of um, women of color, particularly Black women who have higher incidence of perinatal deaths or maternal deaths. So a public health intervention would work on educating them in preconception during the family planning stage, educating them in the OBGYN offices when they go for their annual visits before they even consider pregnancy, so that they can do the things necessary to improve health outcomes prior to getting pregnant. And it can also occur at the OBGYN settings as they get their prenatal care as well. That's another example. And so education is one of our key um, um, tools to fight, and it's something that social workers have been heavily involved in. Earlier in the course, we talked about public health having its roots in social work. And one of the largest interventions that social workers would provide and still do today is education, helping patients understand their risks, understanding the treatments and interventions that they need, or the health behaviors that they need to adapt to improve overall outcomes. But we take it a step further. Other than educating, we also assist, make referrals to community organizations, referrals to health education programs, to insurance companies, case management services, and the list goes on. Another public health intervention is regulation, and I talked a little bit about that. That is how states, how agencies or institutions like schools put certain regulations and or policies in place to help improve the health of its particular population. And so we talked a little bit about that during the PowerPoint examples of the school district regulating vending machines, how many that are listed in the school. Some of them have removed those vending machines with junk food in it, high sugar snacks, and either removed them altogether or took out the snacks and put healthier alternatives. And prohibition is controversial, as some people feel that it borders rights. But prohibition, think about liquor at one point, alcohol, there was prohibition on alcohol. That has changed. Think about prohibition related to marijuana. There's some states where it's legalized and some states in which it's not legalized. And those regulations can be on those prohibitions can be on specific products of consumption, but prohibitions can also speak to behavior, not smoking in public places, for example. We've also seen a lot of prohibition related to what type of health behavior you can engage in and when. Another example we can apply to this is COVID-19. I would say that the area of education is probably, which I stated earlier, is one of our strongest tools. Um, we haven't been doing a good job with educating the public, and there's plenty of reasons for that. One big reason is there wasn't enough known about it early enough, and then even when we did find out about it, the gathering information, the research, understanding how it's contracted, how it spreads, all that was slow coming, and because of that lack of education to the public, it spread more rapidly, and then the deaths associated with it wasn't a lot of education on who were at high risk. We knew people with pre-existing health conditions are more vulnerable, but that's pretty common across chronic health conditions and other viruses as well. But again, not enough education toward key groups that were affected, like people of color. Regulations were slow to come, and prohibitions were slow to come. Some of the regulations related to COVID-19 had to do with self quarantine. Regulations also included people working from home, and that was regulated through employers. Regulations on businesses to not have indoor eating, for example. Prohibitions included, not being able to go outside without a mask on. Prohibiting group gatherings are also an example of some of the interventions we put in place for COVID-19 specifically. And so you see health interventions occurring. And then again, it's always controversial with the prohibitions because people feel like that's an infringement on their rights. And you've seen that also with COVID-19 with the anti-maskers, for instance. You've seen a lot of pushback from small businesses. We've heard of some businesses continuing, such as gyms, to continue to stay open, and owners receive hefty fines for that. Again, regulation and prohibitions. are examples of that, where gyms remained open to continue to allow people to come in and work out, even though that was prohibited by a lot of the restrictions on businesses. And so again, we've seen that, and we've seen people protest. There's also concerns. You've seen a lot of regulation discussion and prohibition related to schools. Another thing, in terms of regulation and prohibition, you've seen, and even in education spheres, you've seen a lot of politics playing a role. We do cover politics and its impact on public health in this course, and I'll talk more about that during that segment. But just be mindful of this year being or any election year. Any year where there's a high level of election activity, you will see po- politics in all areas, but particularly in public health. And this is a real interesting year because it is the year of COVID-19, and the involvement of that, and it just so happened to coincide in an election year too. So there's a lot of political or politicizing this public health issue, and how presidential candidates particularly are going about addressing it or not addressing it. So again, it's been politicized. The government control on the CDC and NIH, and how information is being disseminated into who and how. Again, that has become political as well. So just be mindful of that when we think about public health interventions and how that's showing out, how that's playing out in the U.S. today. Education informs the public about healthy and unhealthy behavior, like the effects of smoking, as stated, and dietary allowances. Some states have mandated, and federal agencies have mandated the posting of nutritious information in fast food places. If you read your food labels, it's required that dietary allowance, you often see that on food labels as well in grocery stores. And so you're able to read the back of the label of all products and see what the nutrition content is in it: sugars, sodium, for example, calories. And that's all regulated by the FDA. Effective approaches include health education in schools, such as sex education, which is controversial. We talked about that in this course. Physician recommendations when people are attending their primary care doctors, those are touch points for health education. And that's why, particularly with the Affordable Care Act, there's focus on more primary and prevention written in that policy. We'll learn more about that, or you're learning more about that when we talk about payers. We talk more about how primary care is a key feature of the Affordable Care Act, and part of that is for the um, and so Obamacare focused a lot on primary care as a key touch point for health education as well as prevention or primary level of care, for particularly for chronic health conditions, but for populations that were vulnerable for health condition, with the goal of catching an illness or chronic disease before it becomes a problem. And that's what primary care focuses on: screening, and wellness checks, to hopefully target things before they become a problem. Use of advertising such as public service announcements, and social norms, are also a social norms approach also helps with public health education. And advertising can also be, the billboards that you see when you're driving on the expressways and or when you're riding public transportation on the trains and buses. Regulations is warranted when its intent is to restrain people from harming others. Again, we talked about this. Public laws includes laws against murder and assault for injury and violence, traffic regulations to cut down on injuries related to vehicular accidents, restrictions on alcohol, drugs, and tobacco, laws to prevent minors from engaging in unhealthy behaviors, laws requiring vaccinations, and you'll see that often in school districts. A lot of schools require vaccination records for and daycares for children. Sexual behavior is harder to regulate, But we do, but there are doctors' offices and other providers that provide premarital screenings for STDs. The 18th Amendment's which banned alcohol was effective in reducing disease caused by alcohol. Prohibition against drugs such as heroin, marijuana, and cocaine is generally accepted. We also had a period where there was a war on drugs campaigns in the mid 1980s. But the research from that war on drugs, that campaign to reduce the use of substances, was found to be ineffective. Research after the war on drugs demonstrated that the Just Say No campaigns actually served to increase the use of substance use. However, at the time, the war on drug was considered it was considered to be an expensive campaign, and it empowered criminals at home and terrorists abroad. And it sent thousands of people, particularly people of color, to prisons for minor offenses. So that was considered a failed public health prohibition attempt. And so, to what extent do you think people choose their own health? So, as you move along through the course, and you think about our discussion on health disparities and chronic conditions, how people are impacted by chronic disease and illness, particularly particular groups. Do you think that they choose their own health, that they have the power to change those health outcomes? And what are some of the ways in which health is affected by factors not of one's own choosing? So there may be ways that people do have a direct control over their health, but there may be some ways that they don't. So think about that, particularly as it relates to health disparities and social determinants of health. Um, um, there are decisions that sometimes people make that put their health at risk, and even if it's for a good reason. One example during COVID-19 was there were a lot of churches that continued to engage in worship services, even against the gathering, the prohibitions on group gathering mandated by states and local governments. And they decided to continue to gather. Now, that was for a good reason, for spiritual support during tough times, during when people were losing their jobs, afraid for healthcare scares, scared of praying for people who they lost, who died because of COVID, and wanted that spiritual support. That's what the church community and the spiritual community is there for. However, there were some fears that the congregation and congregating by church for churchgoers increase the infection and spread of COVID-19. So, as an example, to what extent do people choose their own health? Would you consider people making conscious effort to potentially put themselves at risk for COVID for their spiritual needs? And what are some ways in which health is affected by factors not of one's choosing? So, what are the systemic policies that could have been put in place or were not adhered to that might have contributed to people becoming ill, in terms of the power and preference of some religious leaders to continue to have church services? Would that have changed the outcome related to that example? What did you learn about health related behaviors in school? Think about that growing up, your sex education class, or if you have children, what health education behaviors occur at school? Is it nutrition related? Is it obesity related? Is it teaching students to exercise? Think about what type of education you received in school um, about health behaviors, and or do you feel like there was none, and more targeting needs to happen at the grade school level and up, for Americans to better take control over their health and learn healthier behaviors? Do you think your health education classes were effective in influencing your health behaviors? Yes or no? And if no, why? How many laws can you think of that regulates people's behavior for the good of the public health? Visit health website of healthfinder.gov, which provides more information on Health Department of Health and Human Services services and information on healthcare. You can also browse the news archives um, as well to get an idea of what are some of the public health regulations, particularly related to COVID-19. Look up the Department of Health and Human Services Information Center related to COVID-19 as well. And how many news releases discusses the 10 leading causes of death do you remember in the last few months or even the last year that was discussed in this PowerPoint? We definitely know in the last several months since March, a lot of the news releases and news archives have been focusing specifically on COVID-19. But it'd be interesting while you're taking this course to have a better understanding of the leading causes of death and how much from a public health education standpoint were you aware of, and how much you'll be aware of it moving forward, regulations and prohibition. Um, Thank you for taking the time to listen to this video.